Welcome back. This is Fantastic Pains and How We Hide Them. I'm not Chris.
And I'm not Karina.
But we're here together.
As usual.
And we are in a mood.
It's a good mood.
Yeah.
It's good.
But we've got some stuff to like rant and rave about, so it'll be a really good episode.
My eyes are tearing up. I was laughing so hard.
Oh no. She's crying. I made him cry.
She made a funny.
See, I told you I just beat him up right before we get started.
Yeah,
I don't know.
it's abuse.
Too bad you'll never see the in-between.
I'll sneak it in. I'll like I start sending SOSs out in my editing.
Wear yellow if you need help.
Shit.
No, not the yellow.
I don't have any yellow
You're
clothes.
like, yellow makes me look washed out. I can't. Sorry.
Can't.
No.
All right.
Today, what is our topic? It's going to be a good one.
We're going over medical trauma.
Mm-hmm.
Because we may have been experiencing a lot of that this week.
Yes.
And then
yes.
In general, people need to know, or at least should know, that it's not just them.
Right. Well, and that, like, not only are you not alone with it, but it's way more common than we'd like to think.
Mm-hmm.
Like, we would really love to think that our medical providers are going to be on it all the time, but it's not always the case.
Yep.
And a lot of the times it's not even usually the case.
Right.
But we have some sharp contrast today, too.
Yeah.
Because I had my appointment and that was
You
different.
had a good one.
Yeah. So do you want to plug first, or
Yes.
should we jump into the weekly?
We should plug.
Okay.
I will go first.
Okay.
If you're listening to us, you can watch us on YouTube. So watch us live. We make funny faces.
Mm-hmm.
She's flipping me off for most of it. It's great. If you're watching us, you can listen to us. We're on Spotify, most podcast sites, except for Apple.
Never Apple.
Never Apple. And we also have a Discord if you'd like to jump in and join the conversations that we have.
Yes.
Or want support.
Right. Well, in our Discord community, like, I can't say nice enough things about them. And we're actually going to call some people out today. Mwahaha.
That sounds so mean. We're going to call you out.
Calling you out for being awesome.
But yeah, is there anything else I forgot? Like, comment, and subscribe.
Yes.
Share if you find it useful.
Yes. Or if you're like, this is the absolute worst, you can do that too. I don't know.
Yeah, let us know.
It's fine. We also have a TikTok where we have some funny stuff that you can check out. We are not at all regular about uploading, but we do have some new ones as of this last week.
Yes, I made some.
So that'll be really fun. So I guess that makes it time for the weekly recap.
Check in.
Mm-hmm. I will go first because I had a more normal,
I had a
normal-esque, like, ish week.
Yeah.
I worked 2 days this last week, and then I probably sound a little congested today
because you're congested.
My life is a little weird right now. I had to it's been, I don't know, when did I work first? Tuesday. So Tuesday night through today, I've been like, am I sick? No, I'm not sick. Am I sick? No, I'm not sick.
It's true.
Must
like
be
every
MCAS.
Day.
I think it's MCAS. What is this?
Every
What
day
is
we were supposed to
happening?
hang out, you're like, I think I might be sick.
Yeah.
I might not come over.
And so I feel like, and I don't feel ill.
Yeah.
Right? I just wake up with this like just super thick in my throat and vocal cords and vocal folds, whatever they are, and my sinuses. And so I think at one point in the last week, something happened and I was suddenly able to breathe through my nose again,
Yeah.
which I haven't for a while. But now it's like draining all this infection, I guess, which is fun. So I think I've had a sinus infection for a bit, which is just so exciting, right? It's also been super smoky, so
Yeah.
it absolutely could be that. We sleep with the window open because of the swamp cooler,
Yep.
and then the swamp cooler blows all night. So it absolutely could be MCAS or due to the smoke or who knows what, but I do sound a little bit off today, and that is why. Work was fun. I enjoyed it. It's been a while since I've worked like severe needs.
Yeah.
And then so Tuesday was kind of a normal day. Wednesday was fun because I got the behavior kid.
Yeah.
Not a behavior kid. Super fun, super sweet, really funny, cute kid.
You were very excited to talk about
I
him.
love that.
Yeah.
Like, I'm like, give them to me naughty, because if you think they're naughty, I think they are like fun. They're so much fun to work with. So that was really good. What? Oh.
I'll have to get into it on my recap.
Yeah. Let's see. Thursday, I did not work because I had neurology, I think, which was actually really good. I had a really good appointment. I actually really like this doctor a lot, and I forget because I only see him once every like 3 to 6 months.
Yeah.
So, but we talked about how the dysautonomia has been really bad, and so he gave me this like checklist or like a guideline for managing orthostatic intolerance and hypotension, which is really interesting because it just kind of reaffirms all the things that we already do.
Yeah. No, it's an amazing list.
Right. So one of them is like using physical counter maneuvers. And that's like crossing your legs like mine are right now, or putting one up on the chair, or sitting on your legs, or so all of the weird bi-sitting that we do.
It's actually...
There's a reason for that.
Yeah.
And then he also, this is really interesting because if you've been with us for a while, you know that I've had like group therapy, and they keep telling me that I'm avoidant.
Yeah.
I'm not avoidant, actually. There's a reason that I'm like, no, I have to keep going all day and then crash at night, because people with dysautonomia, if we stop moving, the like muscular pumps in our legs and lower body stop pumping, and then all of our blood settles. And so when our blood sinks into our lower half, we crash, right? So there is a reason that I do that. Yeah.
Well, and it makes so much sense.
And it's not because I'm avoidant.
And we've always described it as a physical problem to get going again.
Right.
Where like, it's not a matter of like, I'm tired. It's a matter of I can't move.
Yeah.
Like it's so much
like,
harder to get started.
And I like my limbs are heavy and I feel weak and shaky and like all these things.
Yeah.
He also told me that I need to be drinking 2 to 2.5 liters of water per day.
I do that.
Which is a lot. I do not do that because stomach hurts.
Yeah.
A lot all the time. Speaking of stomach hurting, he also told me that we should avoid large meals because the blood goes to your gut to aid in digestion. And that's something that we do just kind of naturally anyway. Yep. But yeah, super, super interesting to go through. And then he was like, we feel really helpless about dysautonomia because there's not a whole lot we can do. But he also did suggest that if nothing on this list is working, or they're all things that we've tried before, we could consider an abdominal binder to help return blood to the heart, which is funny because I think it was last week or the week before that I was talking about wanting a core set because I'm like, I need to hold all this up. Yeah. And if my core isn't actively like holding it all up, I just sink. Mm-hmm. And it's a problem.
And there's a solution for it.
Right, exactly. So it was a really good appointment. I was really happy with it. But on my way to my appointment, I got a call that my husband is concussed. Again. So my sister-in-law went and got him.
Okay.
And took him home and he slept. And it's actually not a really bad one. Which is really good. Because he's had a lot of them. So I was...
You married the right person then.
Right? I was like half concerned. But again, okay, here's my thing. Even then, I was like, I could be worried or I could wait for more information.
Yeah.
And so I put off the worrying until I like know what's happening.
Right.
Is that avoidant or am I just regulating myself? Because like worry is not productive.
Would you have made that call if like you were just in another city? Say like it wasn't, you weren't doing something actively.
Oh, if I was like kind of sitting by idle?
Right. Like if you were just somewhere else and that happened, would you avoid the feeling or would you? I
think I'd be more active in seeking information for sure. But again, like I wait until I have information. I'm like, it could be really bad and we could be looking at like something like my mother-in-law, or it could be super mild and he's got to sleep for a couple days.
Right.
So
you're not supposed to sleep with a concussion.
That's what they say, but that's not true. Sleep with a concussion. Yeah. Your brain needs to sleep.
They just don't want you to have swelling.
Right. Well, and he smacked like right in the visual.
Oh,
and man. So he was like, everything was super bright, but he was like totally coherent and sounded like himself and was like with it. He just had physical symptoms, which tells me that like, okay, you just need some like recovery.
Yeah.
But so I've been keeping eyes on him for the last couple days. And then Friday we had group, and that sucked. It was really bad.
I sat here for it.
It was really bad.
It was.
It was not a good time. Yeah. So it was just like putting all of those worksheets that we've been doing together.
It's what we called last week. I rewatched our episode. I was like, I hope it's just them putting it all together.
Yes.
And that's what it is. It was like the worksheet you did was basically the formula of putting everything together in one place.
Right. But it's boring and it's tedious. And then it went from boring and tedious to like pounding my head against the desk kind of thing. Like I had to turn off my camera because I was like, I cannot.
It was,
ooh, no.
I was paranoid to talk at all because I wasn't watching it happen. My face was on the desk for most of it, or the table, because I couldn't handle it. But I wasn't sure when you were unmuted or not.
Yeah, no.
So like
I stayed muted. Like,
I was
the whole
paranoid
time.
that that you would like accidentally unmute yourself.
Oh God.
Because
I had to check.
She
every
had a
once
lot
in a
of
while
words.
I was ranting and raving, and I was like, "Why are we doing this?
We
this
both
is
were.
so dumb."
To be fair,
It was really bad because it was just like calling things ableist that are definitely not ableist.
no.
It was just really bad. It was really bad.
My problem is that talking about it makes us sound callous. Because
yeah, but
the problem was that it was a bad example of a problem.
yes,
Because the girls were more worried about the actual problem instead of working through it.
right.
It was just a bad example. They should have used something else.
Well, and I feel like there should have been more guidance in it.
Yeah.
Because they were like, what were the two examples? It was, I'm too old to make friends. And then it was, I'm a bad friend because I can't show up the way
Yeah.
society expects me to. And then I put in and was like, your friends are not society.
Right.
There's
no
go.
societal pressure in your friends.
Right. And they did not like that.
No.
Nobody liked that.
Well,
very much,
most of it
so.
was you could just talk to your friends. You could just talk to your friends. Like,
Right.
On all
Like,
the examples they had.
Yeah.
Like I said, it was just a bad example.
Right.
And you could tell the girls were genuinely just like worried about their friendships, and they were like, let's get into this. But
Which, like, and I get that.
Yeah.
Like, I understand because there have been times where I'm like, my friends are moving into deeper friendships without me because I'm not around as much.
right.
But on the other end of that, like, I can't be upset about that.
Right.
Well, I mean, I could if I needed to, but I'm also doing that. I'm actively making choices that are for, like, looking after myself.
Yeah.
And I do show up when I can, and I do show up where I can.
Well, they still invite you to, right?
Exactly.
Yeah.
So I'm like, and they understand where I'm coming from. These are all people who have probably watched me nearly pass out 3 to 4 to 5 times.
Right.
Right. So it's not like they don't understand why I'm not showing up. And that was my big thing, was like, if they are your friends and they understand like where you're coming from, this shouldn't be a problem. Like, maybe talk to them.
Right. Just communicate.
Right. Or
But
invite them to come hang out with you and
I
have
think
a
what
pajama
frustrated
party
you
or
most is
something.
that you couldn't just say that.
Yes.
Like, because it had to be about the formula and working through a problem.
Right.
And it just doesn't work well through their system because it's
Right.
not a really good stuck point.
Mm-hmm.
It was a mess.
It wasn't good, but we'll see. Next week might be different. I don't know. It's just annoying and frustrating, and I feel like I'm not being challenged, and like, I know that's
That bothers
selfish
you. Yeah.
of me to be like, challenge me, please. But I'm also bored out of my mind if you don't challenge me.
Yeah.
Like, I really need the stimulation.
It's just the way your group works is so different than mine.
Yeah. Well,
mine
part of
was-
it's because it's virtual.
Yeah.
And so there's not that like person to person connection.
Yeah, you can't like
Yeah.
you can't just look across the table and address somebody.
Yeah.
Which is what I really liked about group was
Yeah.
being able to talk through other people's problems and like relate and be like, well, this is what I've been through. Like it's similar, but I did
Something
this.
similar. Yeah, exactly. Right. And it's very like, and I think it's because it's pain and PTSD.
Yeah.
And then they're like, they don't want to trigger people, so they have to keep things really vague, which I don't think helps. I do not think that helps. And honestly, like, when's a better time to work on skills than when you're triggered?
No.
Like, you
I
have
get
a
it.
bunch of people to help you walk through it right now. Here we go. But I don't know. Just me. Wasn't my favorite thing.
No.
But yeah, you had a week.
Yes, I did. I had a very annoying week.
Yeah.
Like, I did the back appointment, which was really obnoxious. So, like, we got there 15 minutes early. We get seated into a room. An hour and a half later.
Oh my God.
An hour and a half later, Dr. Sarai shows up. What? Yeah. I don't know what was going on because there was nobody there. It seemed dead to me.
Wow.
But I had to wait for, I don't know why. Because my appointment was at 11, but I didn't get seen until like 12:30.
What the heck?
Yeah. And he came in and my spine looks good, which is good.
Yeah, images came back okay.
Yeah, which is, I mean, it's upsetting because I feel like I've wasted time like, chasing this down.
Procedure is so hard.
Yeah. Oh, man, I felt very defeated for like an hour. I got over it. But at the time, I was like, God damn it.
Yeah.
Because now I have to do another nerve study to see if we can find nerve damage in the lower extremities.
Yep.
Oh,
but that was the other thing we learned from my neurologist.
Right.
Was that, so I've been like wearing holes in myself and not noticing. And I have an entire dead patch in my finger now because I dug so deep into it. And talking to the neurologist, he was saying that, especially with Ehlers-Danlos, it could be small nerve, what is it? Small nerve fiber neuropathy,
that's, I think is what it is.
Yeah. And he said that that's often missed in the EMGs.
Yeah.
And so
if the EMG comes back normal, I'm totally going to suggest that.
Right. Because a small fiber neuropathy. That's what it is.
Yeah, small fiber.
But yeah, he was like, that just happens.
Yeah. So, I mean, nothing bad. I just wanted to make more progress because like I said, I could be working on my elbows have been a problem. My knees really need work.
They won't touch your elbows.
I know they won't.
It's the worst.
But I want them to.
I know.
Touch my elbows, please. Yeah. Please. But it wasn't bad. It was just obnoxious. That time sink.
Yeah.
Like all the
it's all hurry up and wait.
Yeah.
And then you have to wait again and again and again. Oh, that was the other thing with my surgeon. I didn't get to see a surgeon.
Oh, yeah.
Even though I told them to schedule me with a surgeon. And so on Monday I went in and it was not a surgeon. And she was like, let's order an MRI and then set a date for you to see the surgeon. I can't make that date, by the way, so I have to call and change that.
God, it's been a fucking struggle for you.
I just want them to cut the shoulder open and fix it. That's all I need. So, fun times.
Yeah. Let's see. That was Tuesday. I didn't see anyone else until yesterday. I did the editing, which was nice. Got that done. I've been fighting the fucking fatigue so hard this week.
Yes.
Like, I was also at a Concerta.
Oh yeah, that does not help at all.
For some reason, it wasn't getting approved by insurance for like 3 days. So we got that sorted, but I was fighting the fatigue, like actively, like gotta force myself to do things now.
Yeah.
And once I got into the editing, it was good.
You rage cleaned one day. I think it was Wednesday.
Yeah.
Oh, yeah.
Yeah, because that was the day I edited.
Yep.
And I don't know, it was good. Then I saw the dentist yesterday. This is where the story gets real fun. So I went in. We were supposed to do an extraction. It's supposed to be simple, right?
Yeah.
Just go in, extract, you're done. Simple.
Yep.
Simple. Yep. What's funny is that the nurse that was helping, she said, this will be an easy one. And then she's like, I shouldn't have said that because every time I say that, I jinx it.
Way to go.
So,
dental assistant.
They pull the tooth and they're looking at the tooth like, okay, it's not decayed too bad. Like, it wasn't salvageable, but it wasn't infected or anything.
Right.
So I didn't need to, I'm doing antibiotics now. I didn't at the time.
Yeah.
But they're looking at the site and they had like, breathe in your mouth for a little bit. And so I breathed through my mouth and like, look, you can see the sinus moving because they could see the bottom of my sinus membrane. Whatever it's called. There's a very specific name I found out about last night. I can't remember it though. So I'm like, whatever. Yeah. So I go home and I wait like a really long time. I was like an hour and a half before I took the gauze out, and I took it out gently, so I didn't undo a clot or anything.
Right.
Take it out, throw it away, rinse very gently, no spitting or anything.
Yeah.
I was very delicate. Whatever. And then I noticed that there was a bubble in my mouth. And I'm like, what the, what? It's the weirdest feeling. My cheek had a bubble in it. And I was like, why won't it go away? Like, I was so confused, and it kind of stopped for a bit, and then it came back. And so I was sitting in here getting ready for our live. And I'm like, I sighed, and then I felt air coming through my nose and through this hole in my mouth. And I'm like, what? So I close my mouth and I breathe out through my nose, and my cheeks puff up.
Yep.
It was bad. Yep. And it hurt so bad because it was drying it out. Yeah. So apparently they just full on punctured it.
Yep.
There's just a hole. And I didn't do anything. I didn't eat. I didn't drink. I did everything right.
Yeah.
I babied it.
Yep.
I'm good with gentle babying after dental.
Right.
So I'm like, oh shoot. I'm still swollen and I can barely talk. Everything's numb. And I'm like, oh no. So I messaged you.
Yep. And you were like, guess who's got a punctured sinus?
Yeah.
This guy.
Yeah. And I messaged Jen because she was at work, but I needed her to call because I could not talk. I could kind of talk. You can understand me. So she takes a break. She calls. The receptionist tells her it's normal.
No.
And Jen, oh man, when she was telling me about it last night, I was like, no, this is not normal. I've had plenty of extractions. Yep. I know what's normal. Yeah. This is not normal.
Oh, and I told you, I was like, I will even call.
Yeah.
Like, I will call if I have to.
Oh,
because
totally.
that's not okay, and they can't leave you like that.
Right.
That's ridiculous.
So, so I get a call from the dentist herself. She calls after Jen calls them and has her fight.
Yep.
And she's like, so what's going on? And I tell her about what's going on. She's like, oh, how about you come in and we'll take a look at that.
Yep.
And it was after hours too. Like they were closed when we went in.
Yep.
Which I mean, it was nice of them. But
right.
Anyway, so I'm leaving the room. And then right as I get to the bottom of the stairs, Karina walks in. Yep. And I'm like, Karina, I need a favor. And you look terrified.
I was like, what? What happened? What's wrong? Because everybody was at the door. So it was you, our grandfather, and your kiddo. Yeah. All standing at the door, and I was like, "Oh my God, what happened?"
So what? I went out of my room. Sophie came running down the stairs after me because she wanted to talk about going to eat out at a restaurant.
Yep.
Bappa was coming to talk about something, but I never found out because I was like, "I gotta go. I gotta go to the dentist."
He's like bleeding from the mouth this whole time.
Yeah, no, profusely. There was blood all over the place.
Oh my God!
So I keep wiping blood off my mouth, and then I'm like, I need a ride to Southlands. I need to go and get this taken care of. And then, so you drove me.
Yep.
We went there right away. We got there super quick.
Yeah. I don't think I even made it into the house.
No.
You told me what was happening, and I was like, okay, cool. Let's go.
Well, yeah. We bailed.
And we left, and we went to Southlands.
Yeah. And we get in. She ushers us in because they were waiting for us.
Yeah.
Which was nice. I appreciate that they took the time.
Right.
Because, I mean, they made an accident, but it's not like I was going to do anything and be like, hey, oh, I'm going to sue you.
Uh-huh.
I'm pretty sure I waived those rights anyways when you signed, because that's
probably
considered
it's like a risk.
Yeah.
Whatever.
But she goes in, she looks at it, and she's like, wow, there's a hole there. I'm like, yep. And it hurts really bad. Every time I breathe, it's blowing air
like,
over it.
Are you in pain? And you were like, uh-huh. Yeah.
I mean, well, and to be fair, it wasn't like, oh no, it hurts.
No, but it hurt.
It did, yeah. So she puts what is it? Not a cartilage. Collagen block.
Yep.
In the hole.
It's like it's
like a patch
thin little membrane patch, like what you'd use to like patch a tire or something.
It really looked like that.
Yeah.
So she puts that in, and then she sews it shut, and afterwards she tells us, I'm glad you came in. It really needed it.
Yeah.
But
at first, the funny part was that she was like trying to edge around it, like they didn't do it and they weren't responsible.
Yeah, like when I left, it wasn't like this.
Yeah, and then she's like, "Well, I don't know what happened because like we watched it and it was just fine." And then she goes on to be like, "Oh, there's such a nice little clot here that I'm gonna have to take out." And I was like, "Baloney,
dude!
If there was a nice little clot there, the air wouldn't be going through it."
Right? No. And I'm glad at the end she admitted that it needed it.
Yeah.
Like otherwise I would have been like, "Oh, this was pointless." But so she's like, "I'm gonna write you a prescription for amoxicillin and Tylenol 3s." I was like, "Okay, cool, whatever." We take that. We go. I come home because I'm done with the day, but I'm not. I wanted to do the live so bad. Oh yeah, by the way, thank you, Tater Tot and Crystal, for being in the live last night. That was so good.
It was a lot of fun.
It was.
Yeah. That was a good way to like wind down
Yeah.
after that nonsense.
I needed it.
Oh my God.
I was still bleeding too as we were sitting here doing live. I'm just like, whatever. Anyway, so I go to fill the prescription today, and she didn't fill out the number of pills on the Tylenols. So I just have my amoxicillin. And instead of like making a big deal about it, I'm just so burned out on this whole thing that I'm just like, whatever. It's just be done with it.
Yeah.
So that was my last 24 hours.
Yeah. But you've messaged David, and
Yeah.
we're going to work on making sure that you have appropriate management for it all. And then they didn't even give you a bite block or anything. Like,
oh, no. They didn't put
just,
glasses on me.
Held your mouth open with sheer force.
Yeah. And they
And
didn't
then manhandled the crap out of you. Well, and I could tell too.
Yeah.
Because you do the same thing I do in the chair where you cross everything. You're like, cross your arms, cross your ankles, and you just sit and you're like, don't react at all. Because then it becomes a game. And this is the thing about the dentist, is a lot of the time with Ehlers-Danlos, we don't numb well.
Nope.
We are hard to numb, and it's hard for us to stay numb.
Roy has the same problem. Yeah. Yeah, he had an extraction 2 weeks ago, and he had the same problem. They had to numb him up halfway through, and then again.
Yeah, because we don't stay numb, and we don't numb up well at all.
Yeah, but I was in a rush.
Great. Yeah,
so I was like, I just want to get it over with.
That's the game. Eventually, is like, do I sit here for 100 years while they try to numb it and fail, or do I pretend to be numb and we get it over with really quickly?
Yeah,
and then we pick that option.
I'm just glad you picked up on it.
Yeah.
That's funny to me because that's what I do. That's how I've always done it. Like cross everything, and then you just
you're like, I'm just gonna tune out, and then the body doesn't get to react to the pain at all.
Yeah.
And then when it gets really painful, you can see everything like just tense up.
Yeah.
But then you can see like the like very intentional release again.
Yeah, they're like, oh, I tensed. Now calmly release.
You're like, okay, hold on, let's let everything out again.
Oh yeah. The funniest part about the whole thing was when they were working on me. And they were two things.
Oh my God.
They were suctioning out everything, right? The nurse put the suction into the hole, so it was pulling air through it, and it was tickling the back of my nose, so I was either going to cough, sneeze. I was going to react in some fashion, and I was trying to signal to them that I'm having some sort of reaction, and they're like, what? Are you in pain? And I'm like, no. And I'm trying to like tell them, but the suction's in my mouth, and I'm like, it was a mess.
Because he's holding up a finger, and they're like, what? While still in the mouth, like they didn't even stop to be like, what's going on, bud?
Yeah. Finally got their attention. And the other thing that happened was
oh my God.
The assistant was doing her thing with like getting it prepped.
Yeah.
And the dentist wasn't paying attention.
Oh God.
And she raised the chair, so everything went down my throat.
Yeah, that happened.
I have fun dentist adventures.
Oh God, that was the.
So yeah.
I was watching it all happen, and she's like in your mouth, and then the chair just comes up, and it came up quick too. Yeah. So you just had like this like invasive gag happening.
Yeah.
Oh God.
It was fun. Yesterday sucked, and then when everything wore off last night because they double numbed it, and she had to like scrape up the site to get the blood to clot again.
Yep.
So it was just so painful.
Freshen the edges,
dude. I was in pain.
It was not nice.
No, after we did the live, I went upstairs, lay down, and then it started, and I was like, oh no. Right,
because the numbing starts wearing off, and then it just burns, and then all the pain comes through, and then it was not a good time.
Better
and
today.
Then your poor ice pack.
Oh yeah, they gave me one of those like pop it and shake it ice packs, and I popped it. I was about to do it. I got the phone call and left.
Yep.
Got home. Ice pack is hot. Like, great.
It was not a good time.
No.
But we got it taken care of, and thank goodness we did, because that was not good. And you were bleeding, and it was hours and hours later.
Yeah.
Because I came over, and it was probably like 4:15, 4:30 at this point. Probably closer. Yeah, it was like 4:15-ish.
Yeah.
Yeah. And then we were out of there by 5. So they were really quick. Oh, the funniest part for me was during our live. So they forgot to give him any kind of post-op instructions at all. And so this dentist calls him from her cell phone to give him post-op instructions.
Yep. She was like, don't sneeze with your mouth closed. Make sure that you don't put pressure on it. No suction.
Do you know what Sudafed is?
Sudafed.
Dude.
And I was like, yes, I know what Sudafed is. I'll take Sudafed. Like, I don't mind. It was just so many.
It was a mess.
It was a comedy of errors left and right.
Yeah.
And I swear it's because that the assistant was all like, this will be normal and easy.
Right. Well, and my whole problem is that, and I had Medicaid for a very short amount of time, so I could be totally off base here, but people treat people with Medicaid way worse.
Probably.
And with way less regard.
Yeah.
It's not nice. It's not okay. It's not okay.
Yeah.
And so our topic today is going to be medical trauma and how we cope with all of that, because we've all had horrendous experiences.
Yeah.
And dental is a big one, just in general.
Yeah. She wonders why. She's like, why don't you go to the dentist more often? Like, because it's never good.
No, it's always awful. And she has seen you 4 times and was like, what's EDS?
Yeah. No, I tell her every time and she doesn't listen.
No.
And then she just berates me. Oh, your teeth are so bad. It's
Right.
Like, I know.
Like it's your fault.
I'm aware. I've
Yeah.
been proactively trying to keep them.
Right. Yeah.
I would like to keep my teeth, please.
Right. Well, and I've got 4 missing. 1 crown, 1 root canal that's not crowned, and it's just a hole in my
Yeah.
tooth right now. So it's definitely, EDS plays a big role in how our teeth are taken care of or not taken care of.
Yeah.
But yeah, dental is a big one for medical trauma, I think.
What's interesting though is that she wasn't like mean about any of it. Like, I'm sure she felt bad that it happened.
Yeah.
Like, they were very accommodating.
Mhm.
But
But they were Russian too.
Yeah, there were so many like things that went wrong that shouldn't have gone wrong.
Yeah.
I don't understand.
Right. Well, and then she got splashed in the face at one point and was like personally offended. Like, I was watching her and you could see she was like this close to melting down. And then she was like, it's the end of the day. It's fine.
Yeah.
Like, it was your fault because the assistant splashed her in the face with mouth
like,
water.
I didn't do anything.
Like,
It's not like I spit on her.
right. Yeah. So there is this like air of inconvenience, I guess.
Mm-hmm.
But also like, oh, we got to fix our problem because we made this problem and we don't need the bad publicity.
Oops.
Yeah, oops. Well, it's not like we said where it is or who.
Yeah, it's definitely. I'm not gonna say it. That would be.
It's a
fucked.
dentist.
A dentist in Southlands.
You never know who. I don't know.
It takes
Yeah.
Medicaid. That's not hard to figure out. If anyone wants to like figure it out,
Right.
not hard.
Yeah. But it's just, it's a mess. It's a mess.
Yeah.
Dental is the worst, and dental is the one that I avoid.
Yeah.
So I do like 1 procedure every year because that's all my insurance will cover.
Mm-hmm.
And then not even cover because I still wound up paying $700
Yeah.
for the root canal and crown.
Yeah.
And that's all we did this year. And then I'm like, what happened to insurance is going to cover whatever. And then they're like, oh, it should. And then it doesn't. And they know it doesn't. Like,
Yeah.
somebody somewhere in this office knows it does not.
Right.
But it's just, I feel like dental is such a scam.
Mm-hmm.
Just in general. And dental insurance is a scam. I don't understand why having a tooth pulled is more expensive than my surgeries
Yeah.
have been. That's unbelievable and ridiculous.
Mm-hmm.
And dentists have no problem just being absolutely horrible to patients.
True.
Like, no problem being
Also,
horrible to patients.
why do they always talk about what they're doing over the weekend or what they did over the weekend? What? I don't understand. Is it part of procedure? Because
I don't know.
there's no way that in the middle of the week, in the middle of the day, that's the first time they've had this conversation with each other. But every time I go in and see them, they're like, what did you do last weekend? Or what are you going to do this weekend?
Yeah, talking to like the
There's no
assistant
way that
between
that's
them.
that's
Yeah.
just coincidence that always happens.
God, it's awful. And if you have a good dentist, you have a horrible assistant.
Oh.
And if you have a good assistant, you have a horrible dentist. And it's just not good. And it's never been good. And I've never had a good experience with a dentist.
I have.
Ever.
I have had one good experience.
Have you?
Yeah. Dr. Shanks.
Shakes?
Fucking loved that guy.
Where?
I don't remember.
Oh, no.
He was in the long ago.
I had one oh, well, okay.
We're talking like 2010.
Yeah, it's been a long time. I did have one good dentist, but then they charged me out the nose.
Yeah. Jen found one that her insurance covers that has really good ratings. So we're going to try and set up there.
Yeah. Well, and that's the thing. They're like, when was the last time you saw a dentist? And you're like, I see one every year, but not the same one every year.
Nope, always someone different.
Because I'm always trying to find someone who's not horrendous. Mm-hmm. And then you're like, no wonder people become avoidant.
Yeah.
And it's not, especially with EDS, because we have weird quirks, we really need them to understand where we are coming from.
Yeah.
And they don't most of the time.
No. Well, and it's one of our notes on here is accommodations from providers, right?
Yeah.
So like, I feel like I'm partly to blame for this in some situations for not being more forceful about getting accommodated.
Oh, yeah.
You know, or making it clear that I have this thing.
Yeah.
Like, I tell them
what it requires.
Right. I let them know what's going on, but they don't go, oh, okay, and know exactly what to do.
Right.
So, I mean, other than telling them that I need like more numbing or stuff like that along that line, I feel like I should be more like vocal about it.
Usually, I mean, the last couple times they've given me paperwork that's like, what would you like them to know?
Yeah.
And I have I have Ehlers-Danlos syndrome. I'm hard to numb and I don't stay numb. And I make sure that that's on there. And then anytime they're like, anything else we should know, I tell them outright.
Right. Make sure that it's said.
I'm like, I will just sit here and tolerate it if you don't numb me.
Yes.
And I mean, to be fair, the last couple times, because I've done that, I get numbed in the roof of my mouth, which helps a lot.
Yeah.
And stays numb much better and is much more reliable, I guess. But yeah, that self-advocation is hard, especially when you don't feel like you're being heard.
Yeah.
Because then you just want to bail out. You're like, okay, fine, I'm going to shut down and let you do whatever. And then we just suck it up.
But that's the thing. Like, who's it on? Is it my fault for not saying it or theirs for not picking it up? I don't know.
I mean, as providers,
be a two-way street.
Yeah. I mean, to an extent. But as providers, it's their job to make sure that they are providing quality care.
Yeah.
And dentists don't seem to care.
No. Well, it might just be my experiences because I have like Medicaid or whatever, but it's always it's like getting a tire change. You go in and they're just like, quick, let's get this over with and move on so that they can get to the next person. So I don't know.
What I don't appreciate is the guilt.
Oh, no.
Where they're like, what did you do to your mouth? And you're like, I didn't do anything.
My favorite thing that she says is she's like, what happened to this tooth? When did this happen? And then I'll be like, last week it cracked and now it hurts. And then she's like, oh, but there's been decay here. It's like, yes, I know.
Great.
I was aware of that. Yeah. But did I not disclose it to you well enough? Was I not like...
Right? Like you're hiding things.
It's been decaying since I was born, you see. I've had it for this many years.
I put a fissure in it 17 months ago.
Yeah.
And then I ate all the sugar. And then I broke it, you see. Yeah. It's not nice.
And I get accommodated better now at like my primary care.
Yeah.
Like because she's interested in it too. Dr. Bomba's like, tell me more about it.
Yeah.
Or like she when I went to see her last, she had a horrible back pain.
Oh no.
Like apparently she sat in a bad position at a conference for too long.
Yeah.
And like she literally could not stand up or sit down. Like it took her a while to get comfy when sitting. I felt so bad for her. Like, and she was like, I get it. I feel your pain. And I was like, no joke.
Yeah. Yeah. Welcome to my world of nonsense.
I just like that she's self-aware enough to, you know what I mean?
Right. To like put the comparison. That was the other interesting thing about, and this is like the sharp contrast in this last week, was when I saw my neurologist, I mentioned mast cell activation and its role in dysautonomia. And instead of like shooting me down or whatever, he was like, that's really interesting. I hadn't thought about it. Like I haven't thought about how that might affect it. I'm going to do some research and see what that might look like. Yeah. And I was like, you're going to do research?
I'm going to learn?
What?
Didn't you get a doctor once who was upset about, or maybe it was an ER doc, who was like, I don't Google things. Or is that Jen?
That wasn't me. I think it must have been Jen.
Yeah.
Or it was like a story we read. I don't remember, but I do know what you're talking about.
Right? Like,
where it was like, they were just horrible and they decided, whoa, wasn't it this?
Oh yeah, it might.
Yes. Okay, so there is a Facebook post that is just the most horrendous thing. And I literally, I don't advocate for putting in, like, filing complaints a lot because it reflects badly on us and then we wind up punished for it, right?
Yeah.
But this one was intense. I'm gonna let you read it if that's okay.
Sure. So we have Linda, who posted not too long ago, completely beside myself. Yesterday I went to see my normal PA to renew my pain meds. Then he says to me, it says here that you have Marfan syndrome. Nowhere is it written that there is pain associated with that. I said, well, there is, and I have EDS. He replied, well, where is your pain? You should not have any. What are you going to do? What are you going to do? Come here and get your pain meds renewed for the rest of your life? That one bothers me a lot.
What are you going to do? Try to be comfortable forever?
I said, if I didn't, I would be suicidal. He responds, oh, so you take pain meds because you're suicidal. I was trying to be so calm. Good on you. Like, I was like, I'm shocked that in this day and age, you haven't done research on it. You can easily look online and read about that it's painful, that it's a painful disorder. He says, I don't get my medical information from Google. Wow.
Yep.
What is scarier is that he is the only PA and still refuses to learn anything from the internet.
Right.
I was trying hard all day yesterday and not to let it get me down. I'm just so thankful that I have this page.
Yeah.
Holy crap.
Can you imagine? And I'm sorry, that's not even a doctor.
No.
That's a PA who is telling you about your condition that you live with and then refusing to correct his errors. That's terrifying. Terrifying that is allowed to, like, continue. And it's so frustrating. And this is what we come up against, is people who don't believe A, in the syndrome, or B, that it comes with all the things it comes with.
Right.
Because it is a painful situation. Like, just because I can dislocate without breaking doesn't mean it feels good.
No. Well, and then there's the whole outlook that we're collecting diagnoses.
Right.
Like, oh, you're getting
You're one of those.
It comes with it. If my connective tissue is not working in all of me, why would I not have other problems that are systemic? Like,
right. Well, and people who know EDS know what it comes with. And they've, like, that's why I know that it's called the unholy trinity of Ehlers-Danlos, mast cell activation, and generally POTS, but dysautonomia of some kind, right?
Yeah.
It's terrifying that those people, can you imagine somebody who A, didn't have support or was already, like, in a really bad place? Can you imagine how they would go home?
No. Like, it reminds me of when that happened to me, when you go to your normal pain management, be it like your doctor or your clinic, somewhere that you go for your pain management, and then to have them tell you, oh, you're not in pain. Or to have them apologize because you're in pain. Yeah. Oh, I'm sorry for him.
Oh, yeah. Apologize to the people who have to deal with you.
Yeah. I'm sorry.
That's what my mother-in-law's going through. Is like people being like apologizing to the people who are affected by her injury.
Oh my God.
Instead of like, you are affected by your injury. It's more like your injury is inconveniencing everyone around you. And you need to think about that. What?
My God.
Can we take care of the people who are not having a good time? Like, why is that, like, not first on your list? But disgusting. And I know it happens to other people.
Yeah.
And it's happened to me via emails where I've had to email my pain management and go, hey, I just busted a tooth. My entire cheek and sinus are swollen and I'm not having a good time. My jaw's dislocated from the last, like, round of dental, blah, blah, blah. And then being like, getting a response from someone who's not your doctor.
Yeah.
Saying, I don't think you need that. Also, the research says Tylenol does better with tooth pain. And you're like, it's not tooth pain. Thank you. Also, you're not my doctor. Please don't respond to their emails.
Yeah.
Other than to say, they're out of town, they will be back this time.
Right.
When? Because that's the thing. Like, I don't want those emails to appear as read.
Yeah.
Because then my provider is not getting that email because you intercepted it and decided for someone you've never met what's best for them and undermining their provider.
It's that medical trauma there specifically that gives me the crazy anxiety when I go into pain management specifically.
Yeah.
Because sometimes like David won't be there and they'll have someone else there. You never know. It could happen because it's happened to me like twice now where I've gone in to my normal place where they know me and had some new person say, oh, well, you don't really have this problem.
Right.
It's not worthy of pain meds.
Right. Right.
So I do.
Like,
I go in.
That's not a pain condition.
I go to my clinic that I love with the people that I love, like my whole team, and I have anxiety. Like I have this panic just ready.
Right. Because it's this whole thing where you've built up a trust with somebody, but then you never know when or where the carpet's going to be like ripped out from under you.
Right. Exactly.
You're like, how long is that going to last? Are they going to leave? Are they on vacation? God forbid.
Yeah.
Like, right. And that shouldn't be a problem. It should just be like, let's look at your notes from last time and do exactly what they did last time. Do that. Remove your ego from my medical care.
Yeah.
Please. And thank you. Because if you're not my doctor, I don't want to hear from you about what you think about my pain medication or my situation.
Absolutely.
I don't want to hear it. Because I've had people like, there have been times where I had to go into the clinic because I'm trying to remember one of them. Oh, my neck was really screwed up and I could like literally hear the things grinding against each other.
Yeah.
And I went in and he was like, what are you doing for it? Blah, blah, blah. And then they do an x-ray and of course they don't find anything because it's an x-ray. And then they're like, you're fine. Also, I think you need to do some like breathing exercises. And you're like, I'm going to throw you out a window. Defenestration. Here we go.
Let me show you my coping skills list. Let's see what I do to deal with this. And then tell me if I need to breathe.
Oh my God. Like you have no idea what I'm coming to the table with.
I hate that.
So don't talk to me about my plan that I've made with my doctor that I've worked with for years. And don't undermine shit. Like, it's not up to you.
Yeah. Also with accommodations, because that's on there. I have habits that are kind of like accommodations for going to like urgent care or seeing new docs and stuff where you don't want to seem a certain way, right? So you have this like, there's a stigma to what I'm doing for care. So I have to present it just right and fully explain my condition. And then it sounds like I'm a WebMDer because I'm talking about all the crazy shit that comes with EDS just so they understand.
How dare you be well informed?
Right.
That bothers me a lot.
Yeah, well, you have to come in and it's like you said, it's what she's always said, but it's what we do. You have to kind of be like, here's some stuff, and then they have to go, oh, I think it's this, because if it's their idea, then it's, you know what I mean?
You have to do the ego stroking.
Exactly.
First.
Like, here's what I have, and they're like, oh yes, quite, yeah, indeed. Not like I have this exact thing, and they're like, no.
How do you know?
Like, yeah, who diagnosed you? Like, a doctor?
I was afraid when I was with the neurologist because he was like, who's managing your dysautonomia? And I was like, nobody.
Yeah.
And I was worried he was going to be like, well, then how do you know you have it? But then he turned around and was like, okay, sometimes cardiology manages it and sometimes we do. But I'm going to tell you, we feel really helpless when it comes to that one. But he like leveled with me.
Right. No, he
and was a human with me and addressed my concerns.
Yeah.
And that shouldn't be
rare,
unusual. Right.
It shouldn't be the exception.
Why is that like, oh my God, he's amazing in my brain, instead of like, this is the standard of care. This is how we should be treating people.
Yeah.
Just gross. It's gross. You thinking break time?
Yeah, we can take a break.
Okay. All right, my friends. What do we need to do?
I need to do my chores. So I'm not going to do them.
I need to do my homework.
You do need to do your homework.
I'm not doing my homework. I can't print it out, so I'm not doing it.
But you should drink water.
Yes.
Eat something if you can
Mm-hmm.
or need to, because sometimes you have to eat when you don't want to.
Yeah.
I hate that.
Right.
That is the worst.
That's me. Anytime I have to work out, I'm like, I have to put protein in my body first. Dang it.
Mm-hmm.
Yeah. You need to take your meds if you have not, or if you need to. Have a snack because you're a snack.
Yeah.
Like, just do that.
Mm-hmm.
And then do something that feels good for you. Today, the weather is kind of crummy, so I don't know that I will see any sunlight, but I will do something that feels good for me. So
Punching me in the face.
no, that would hurt my knuckles.
Oh.
I'm going to use a tool.
Okay. Well.
All right, there we go.
Going on break. Great. Wonderful.
In the meantime, take care of you, and we will see you in a moment.
Bye.
Fantastic Pains now has merch. I know we've been promising it for a while, but it is here. You can find our stuff at fantastic-pains.creator-spring.com. We have t-shirts, hoodies, leggings, wine coolers, I guess you can call them, and my very favorite backpack. So take a minute, go check us out.
Welcome back. For reals this time.
Yes. We got interrupted.
Yes. Sidetracked by many messages.
Mm-hmm. Yep.
Did you do your break?
I hope you did. Drink some water. We got to see some sunlight, which was nice.
Yeah. Very nice.
I did not expect that because it was gross this morning.
I thought it was going to be overcast all day, but
Me too.
we're good.
And we have yet to see like real rain, which
I
is
know.
annoying. So whatever. What are we gonna get into in the second half?
I don't remember. Oh, we were going to talk about documentation.
Yes. And the importance. And this goes in with the medical trauma because sometimes we see providers who like to prejudge us. And that's how we wind up with things like over-medicated in our file.
Guilty.
Or conversion in our file.
Yeah. Oh, yeah.
Which
Ugh.
is the worst. I hate when that happens.
Mm-hmm.
I also hate when that happens because it's never a psychiatrist
Right. No.
who is diagnosing that. So I'm like, what? How do you know what this is? You don't know. You're just mad at me
Mm-hmm.
because I asked for stuff.
Yeah.
Yeah. So there's kind of two aspects to documentation as I've written them down here. One of which is making sure that doctors are documenting the correct things.
Yes.
As well as knowing when to make sure that they document or ask like explicitly that they document. And that's for refusals specifically. So if a provider is refusing to give you a referral or a scan that you've requested, asking them to document that can change their mind pretty quickly.
Really?
Yes.
I haven't had to do that before.
I haven't either, but I've heard lots of stories of people who are like, if they refuse to give you what you need,
Yeah.
make sure you say, okay, can you please document your refusal in my file? And usually they will turn around and give you what you need.
Nice.
But it's also one of those like, this is going to be a trump card. Make sure you use it wisely.
Yeah.
Because you don't want to tick off a provider that you're seeing on the regular.
Mm-hmm.
Because again, that's how we wind up with those kind of tags in our file, which is not nice. Especially if you are on TikTok, check out some nurse talk and you will see some of those kind of code language words in there.
Yeah.
Where they will use to notify that a patient is difficult or...
I want to know. I need to learn all of that because I'm sure I've been labeled as difficult.
I don't know though, because I don't know.
Well, I bring Jen with me.
Oh, that's true.
So I'm like a difficult patient because Jen won't take shit.
Yeah, which is good because some of us need a lot more help in like advocating for ourselves. Because it's hard. It's hard to be like, no, this is what I need and I need you to follow through with it. When they're like, no,
Yeah.
just kidding. That's not actually what's happening here. And your ideas are stupid and you should stop using Google.
Yeah. Oh my
Which
God.
bothers me in general. It bothers me that you should not know about your own condition.
Right.
Like, in what world does that make sense?
Yeah.
As to like being uneducated on your own
all the good doctors will appreciate that you know stuff.
Right.
Like, all my team love that I know what's going on and I can update them kind of
Yeah.
using the correct terminology.
Right.
Like, I'm able to describe things accurately.
Right.
They love that.
Yeah.
But they're also not, like, predisposed with, like, ideas of who I am.
Yes.
Which is wonderful.
Right. Well, and it's like when I saw my neurologist and he was totally willing to take me at my word when I was talking about MCAS affecting the dysautonomia, and he was like, that's really interesting. I hadn't thought about it. I'll do some research and find out what that is like.
Yeah.
Because that is not a typical experience, I don't think, for a lot of people, to have a doctor take you at your word, first of all, and then second of all, want to do research to better help you. But yeah, I'm trying to think of some stories where we found some icky things in the files.
Well, like you said, I was labeled as over-medicated from one of the ER visits that I didn't know about because I've never checked my record. Mm-hmm. I'm kind of afraid to at this point.
Right. Well, and that's the thing
you need to know what's on it.
Exactly. Is that a lot of us don't know what's on our record. Like, you don't know what's in your notes or your doctor's notes or the PA's notes or the nurse's notes and especially in emergency. I think that is where a lot of those really hard notes come from, because the emergency room is so, I don't want to say jaded, but I think they experience a lot more drug-seeking behavior than other practices do.
Yes, absolutely.
Yeah.
Because, I mean, people go in there when they're just detoxing in general.
Right. So you see a lot of, like, abuse of the emergency systems.
Yeah.
And then that is kind of personalized by the emergency doctors and nurses, which can be a problem if you are someone who goes in and is not A, drug-seeking, or B, like, difficult or abusing the system, and you're there for a good reason. Mm-hmm. Because otherwise, like, you're taken as a hypochondriac, or you're taken as, like, a WebMDer, or drug seeking is a really big one. Which is why, like, I really try to avoid the emergency department as a whole. But even I've seen it happen in, like, gastro with specialists.
Oh, yeah.
Where they don't understand your file, they haven't read your file. And then you come in and you're like, I have these problems. And they're like, oh, I was looking through your med list and I saw that you have Percocet. Therefore, that's what's causing your gut problems. Have a nice day.
Yep. Oh, my God.
You're like, no.
So much more than that.
Yeah.
I hate
but it's
that
hard.
Stuff.
It's hard. A lot of people, like, they quit at that point instead of turning that conversation back around. And I had a couple doctors that I quit with because, I don't know, you can always just tell where you're like, this is not going to be a good relationship.
Right.
And I'm not going to see this person again because they've already decided and made up their mind.
Yeah.
So in the first half, we read that post from Facebook.
Yeah.
And
my God.
That's a huge one. Like, that's a perfect example of the things that we come across. Especially having invisible illness. And if you have any invisible illness, I think you could probably relate to this, where A, it's hard to get a diagnosis, and B, it's hard to explain your diagnosis when people are jaded or they've made up their mind.
Especially if you have to defend your diagnosis.
Right.
Like, who did it? When did they do it? What did you tell them? Like,
yeah.
I've had that question before.
Really?
Yeah. They asked me what I said to the doctor.
What diagnosis was it?
It was for EDS.
What the heck?
Yeah.
Like, there's like a magic password you can give them.
Right. Like I said something sneaky.
I
and
lied a lot. My body also lied. I definitely can't put my thumb to my wrist or bend my pinky all the way back. Like, none of those things.
The pinky isn't part of
they're not real.
The score, but, you know.
Yes, it is.
Not anymore. I took it off.
You took it off?
Yeah, just now.
Oh, good.
I've replaced it with index finger, bending all the way back. It has to touch the back of your hand or it doesn't count.
Oh, no. Oh, God. Guys, I don't have EDS anymore.
I'm worried that's what's going to happen, actually.
Oh, that they're going to change the criteria?
Yeah.
But you have it in your file as a diagnosis.
Yes.
And I think at this point, because you have two siblings who are diagnosed, I think at that point, you would be grandfathered in.
Yeah.
In a way. You know what I mean? Like, doctors can look at you and be like, okay, so you don't have a geneticist's diagnosis, but
Everyone
you
else
have
does.
siblings who are in that box.
Well, I mean, I have a geneticist diagnosis of something similar,
right.
but now we can be like, oh, but we know what it is now.
Yeah.
Yeah, no, I get
Because
that.
he didn't believe in EDS.
No.
He doesn't believe in HEDS.
Benny believes in fairies, I bet.
Fight the fairies.
What a jerk.
He's the worst, not the nicest human being. Where were we?
We were talking about medical trauma.
Yeah, that your
My diagnosis.
your diagnosis
My TikTok.
of something similar. Your TikTok.
Technically.
You're
have
technically
EDS.
diagnosed. But you have EDS, whether or not it's on paper or not.
Yeah.
Like, that doesn't make or break what is happening within your own body.
Right.
And it bothers me that providers don't put more stock into our knowledge of our own flesh, because I live in here every day. Like, literally every day of my life, I live inside of this body.
Well, like, telling them that, when the tooth extraction was going wrong and they were like, oh, it's normal. And you're like, no, it's not, though.
Yeah.
There's a lot of weird stuff happening. And they're like,
Right.
yeah, I'll ask the dentist about it, but yeah.
No, I'm pretty sure that's normal. You're supposed to have a hole that goes straight into your sinuses. It's a good plan. Yeah. No.
Right.
It's obnoxious.
Mm-hmm.
And I don't like that there's like a stigma against being knowledgeable.
Yeah. No, absolutely. That's what, like we were saying in the first half, like
Mm-hmm.
having to lead them along till they come to the conclusion that you have.
Right. But that takes like A, practice, and B,
energy.
like energy to be like, okay, let me try to get you to where I'm already at.
Yeah. No, if I have
so
no
that we can
spoons
move
that day,
forward.
there's no way that's happening.
No.
I'm just going to be like, I have this. And they'll be like, oh, no. And I'll be like, okay.
Well, and there's
Fuck it.
some providers that, like, as soon as you meet them, you're like, this is not going to go well.
Yeah.
And they're not going to listen to anything I have to say, no matter what it is.
I always want to know what it is about my file or me that makes them react that way.
Right.
Like,
Well-
sometimes you can tell, but sometimes I've like met them and I don't, why are they acting like this
Yeah.
towards me?
Yeah.
Is it just a bad day for you?
Right.
Or did I do something?
Yeah. Well, it's like when I saw the gastro. Gastro's always been so hard because, again, it's that like, oh, you're taking Percocet. Clearly, that's why you're constipated. And you're like, okay, but no, because I would have to be taking it at a much more frequent rate and a much more regular rate to achieve that side effect. Thank you very much.
Right.
But it's hard to explain to them when you're like, I have, and at the time, I think it was when we were doing the 24 over 3 months.
Mm-hmm.
Yeah. So it was like 24 pills over 3 months. 3 months. That's not a lot. That's 8 pills a month.
Yeah.
Right? That's crazy. That's not enough to do jack, right? That's a rescue medication that I use incredibly infrequently because I need to bail out sometimes.
Yeah.
But with gastro, it's always so difficult because the first couple times I was talking about, oh my God, I can't remember what it was. It was like the spasming in my gut where I was like, I'm like throwing up or like regurgitating food
Yeah.
all the time. And she was like, oh, well, sometimes people have a sensitive gag reflex. And I'm like, okay, but there's
Not
no gagging involved.
No.
I'm not gagging.
I do that all the time.
Right.
It's the GERD. You shoot up whatever's in your stomach.
Uh-huh. And then she was like, oh, it's heartburn. And I'm like, no,
No.
it's food coming back up.
Do you know where the back of your throat is? Do you know what your tongue feels like?
Uh-huh.
Now imagine stuff coming from your stomach going to your tongue.
Yeah.
Like,
But then you have to lead them along. And then the worst is when they pick one symptom
and stick
to
it.
obsess about.
Yeah. Yeah. Oh,
Where
yeah.
they're like, oh, you have this, therefore. So my first neurologist was like that. So they took it as migraines first, which I was like, but there's literally no headache. Like no headache, no aura. It's all physical and like it's in my body. And she was obsessed with migraines, and that was the only thing that she could get to. And then the next time I saw her, I can't remember what the next one was. It was super weird though, because again, like this is where they like obsess about anxiety a lot. And so they're like, oh, it's anxiety. It's
Oh, yeah.
Everything's anxiety. Absolutely everything's
anxiety.
So you don't know you're anxious, but you're definitely anxious.
It's probably anxiety.
Anxiety.
I was trying to put anxious and anxiety.
Have some anxiety.
There you go. Anxiety.
Anxiety. That's our whole generation. There you go.
Anxiety.
But then the next one was she picked, because it was the beginning of the spasming, so the movement disorder. And as that was coming up, she picked, because I was telling her about everywhere it happens. And then I mentioned that sometimes my eyelid does it. And she was like, that's myokymia, I think is what it's called. I can't remember I'm pretty sure. And I was like, but everywhere? Like everywhere? And she was like, yep. But when you look up myokymia or whatever it is, it's eyelids.
Just eyelids.
That's where that is. And so that was the one symptom that she obsessed over.
Yeah.
Because they want to be like, oh, it's a stupid patient again.
Oh, yeah.
Let me do like a quick, have you tried turning it off and on again?
Yep.
I'm like, yes, I have. I've done all the things. It's definitely plugged in.
Oh my God.
I'm logged into my account. Like,
I'm just reframing everything through computer speech now.
There you go.
That's where my brain went.
But it works, right?
It does, yeah. Like, you have good text and you have bad text.
Yeah.
Yeah.
But the more you know, the worse it gets.
Yes.
Which is frustrating because you absolutely should be educated on your condition.
Mm-hmm. Yeah. It's like, even just coming in and talking about dysautonomia, mm-hmm. I get some resistance on that sometimes.
Yeah.
Like, oh, do you know what that is? How do you know you have it? Like, are you kidding me?
Do you know what that is?
Do you even know?
No, I made it up.
I walk in like, you're done. You're done. Okay.
You used a big word, so we're going to ignore you now.
Oh, great. Sorry, awesome. I came in with knowledge. What happened again?
Oh, man. But, like, that's why we need to know what's in our file.
Yeah. Oh, yeah.
Because people with bias get to make decisions about our health and how we are treated. And that can be really scary sometimes.
I'm just lucky that I had a good primary care.
Yes.
Who went through my file and was like, not over medicated.
Yeah. No.
I mean, like, I bet you that in the very beginning, she probably thought that because she saw the amounts and she was a staunch, like, anti-pain med doctor.
Oh, yeah.
But she saw me on it for years.
Yeah.
And saw that it wasn't affecting anything, that I wasn't abusing it.
Right.
Like, we developed a history and then...
Yeah. It's like we've talked about where with my doctor, early days, asking about pain meds before we had, like, a really strong relationship, like a working relationship. It was like, I also need pain meds, because you know how you go through the whole appointment before you ask and you're like terrified and you're like, oh my God, oh my God, oh my God. And I was like, I need two things as a rescue medication. I need cyclobenzaprine and I need Percocet. Those are the two things that I need. I just need 5s. And he was like, oh, well, and he started and I was like, I can make 90 pills last me. No, it was 30 pills last me 9 months.
Yeah. 9 months.
Yeah. Because that's what I had before when they medicated me at urgent care for the sciatica.
Yeah.
Because sciatica used to just take me out.
That was your thing.
Yeah. And then you could just feel the energy in the room change. And he was like, really?
Yeah.
And I was like, yes, it's a rescue. I'm not taking it all the time. And I'm not afraid of being in pain.
I bet you he even gave it to you as like a test too.
Yes. Oh, absolutely.
Like, he's like, well, we'll see.
Yeah. So he was like, let's do 14 over 3 months.
Yeah.
And I was like, okay.
She was all bet.
Yeah. And I made that work for over a year. Mm-hmm. For over a year before I was like, hey, I could really use some more. And then we went up to, I think, 24.
You also had
months.
more surgeries.
Yes.
And were getting more active.
Right.
Yeah.
Yeah. And so from there, I was able to slowly increase over years. And I'm not kidding. It took a really long time to be able to prove my ability to handle my shit.
Whoops.
What?
I was supposed to decrease my med amount over the summer.
I know, I was too, and it's worse.
Yeah.
The summer's been worse. So
yeah.
I'm not worrying about it because it's been worse. It's been horrible and I'm not having a good time.
I need to go back down so that I can go up for winter. I'll do it during the fall.
Yeah.
That's my plan.
Well, I'll do it if I wind up purgert.
Purgert. Yogurt. Anyway.
So if I have yogurt, I'll have to go down anyway.
Yes.
That's that. Yeah. But it took so long to be able to be confident in requesting an increase.
Yes.
Because I knew that we had a working relationship at that point.
Mm-hmm.
And he had come to understand over and over. I'm not kidding. It took probably a year for us to understand each other.
Mm-hmm.
And then he was like, okay, so you know what you need. You're very active in your own care. And he allowed that and was welcoming of that. But I can't imagine doing that with the first doctor I had, who was like, you don't need a diagnosis.
No. Well, and that's just straight up medical trauma, right? Like,
right.
Legit, you're afraid to approach something simple like asking for a medication.
Yeah.
Even if the worst thing that could happen is they say no.
Right.
Because you're worried you're going to get like judged and then painted and then marked and then
exactly
it'll follow you everywhere.
Uh-huh.
I was so for sure that was going to happen when I quit the really bad pain medic. The one that was just over.
Oh, yeah.
Because I just bailed on them. I was like, I'm not returning. And I was worried that my record would show not only that I was on like a really high dose, which I was, but I took 2 months off before I even started looking again.
Yeah.
But I was worried that they'd look at that and be like, we can't, there's no way. Or that it would be in my record.
Right.
Like negative.
Well, and they make small doses sound really drastic. And then you get to pain management and you realize that what you're taking is nothing.
Yeah. Well, that's what happened to me last time. I'm like freaked out that I'm on high dosage and I'm like, like, just now I was like, I got to reduce it.
Yeah.
But I was talking to David and he was like, oh no, you're fine.
Well, and hopefully it'll be easier for you to reduce in the summer because I'm hoping, or in the fall.
Yeah.
Fall. Because I'm hoping that once we get our ELHS passes, we'll be more active.
Yeah.
And out there and doing stuff. And we know that like activity does help.
Yes.
It's just hard to get going.
Yeah.
And hard to be like motivated about it.
I was motivated. Like we had to park like several blocks away from Dr. Suri's office.
Uh-huh.
And I walked, Jen didn't drop me off. I walked the whole way and I was like, this is fine. I could do ELHS easy.
Right. Well, and I'm
just have
thinking
to have
like
my cane.
Yes. Well, and I'll probably be bringing mine anyway. But yeah, like we know activity helps, but there's a lot that doctors don't see, and we forget that they are people who are fallible.
Well, and the stuff they don't see should be in your record so that you can refer back to it.
Right.
So like you were saying, making sure that it gets documented.
Yes, absolutely. Because that's the thing is like if it's not well documented, people miss it. And so I really appreciate when doctors are like, okay, so I have your referral that says some stuff, but I want to hear from you.
Yeah.
That makes me way more comfortable when I go into a situation like that.
Yeah.
Where I'm meeting a new doctor and I don't know what's going to happen.
Mm-hmm.
And like even Summer's appointment, that I'll let Summer tell about it when they come back on. But it was interesting for me to be able to judge a doctor from the outside, I guess.
Yeah, not
and
being...
be like, because Summer will look at me and be like, did that go well? Like, I don't know how I feel about.
Like, yeah.
And I'm like, yeah, no, that actually went really well. And they gave you options and walked you through what it could be and what it might be and what they think is likely, but they want to rule out the thing that's unlikely, but just to make sure. And so, yeah, make sure that your doctors are paying attention.
And check your record.
Yes.
See what it says. And if there's anything you have a complaint with, go to your primary and then see what can be done.
Right.
Like redact it or have it updated to be like no longer presents this way or has this,
right. Yeah.
Because I still get, oh God, this bothers me. I've never really thought about it, but I get referrals to places and different places that refer me will have different levels of my current care.
Oh yeah.
That makes sense. So like they'll be like, oh, so you have leg pain. I'm like, no, it's
not
nothing.
anymore.
It's totally back and like hips.
Uh-huh.
And like, oh, what happened? I'm like, nothing. And like, make sure you're up to date.
Yeah. Because it's hard. It's hard, especially when you have to see different specialists. And like choosing different specialists is hard because filling that referral can take a really long time.
Oh, yeah.
And then you get there and you're like, please be a good one. And you never know. You never know.
A good example of medical trauma is that I have to do the nerve study, right?
Mm-hmm.
And the last one I did was a just horrible botch of a like experiment on my arm and my right leg.
Yeah.
Because they didn't find anything, and it was not pleasant.
Mm-hmm.
You know, it's a lot like an ablation.
Yeah. Well, and I had the nerve study done on my leg, but only one leg.
Right.
When I was like, this is happening all over the place.
Right. So that's like I have to do that, and I'm waiting now until I get the approval. And once I have the approval, I can make the appointment. But the appointment probably isn't going to be until after August.
Yeah. Yeah.
Like,
It's like, it's frustrating. Because with neurology, I had to take the day off from work because I was like, I've been waiting for this appointment for like 3 months.
exactly.
So.
I mean, that's part of the trauma, like having to wait.
Yeah.
Having to see a very important specialist about an urgent problem way out in the future.
Right. And then, especially with EDS, because we know things come and go, they just do. Having the referral ready to fill, and you're like, that's not a problem anymore.
Right.
Actually,
you missed
this other thing.
Yeah. That's what I'm worried about with my back, because it was a really good day.
Oh.
So like when I did the imaging, I was like, there's no way anything's in my back, even though I know there's like narrowing and stuff.
Right.
It just didn't pick it up because there's no.
That's so stupid.
Yeah. Yeah.
We need to get you on the massage table too.
Yeah, that would be great.
Yeah.
Get mushed.
Because he's mobile now.
Hypermobile.
He's not hypermobile, but he's mobile.
Okay, fair.
So you could go to his house, or you could come here and do massage.
I mean, I have a table.
You did. I think he has a mobile table that he would bring. Just saying.
I only use hypermobile
No, we
tables.
sit on the floor, and he stands on top of you and massages you with his bare feet.
So I could just have Jen do that.
Yeah. I will mention though that like massage can be really, really helpful in Ehlers-Danlos because we are hypermobile, our fascia is moving a lot more than it would otherwise. And it clings to things all over the place.
Yes.
And you can get totally locked up within your like myofascial layers.
That's what my ribs are doing right now.
It's not good.
It's moving. As it tenses up, it's like a very slow moving sand dune. Just like going down my back, pulling my one rib that it's on top of out.
Yep.
And then it goes down.
Yeah.
Oh, I hate it.
Well, and it's bad because like I like to sit all crunched up.
Yeah.
And then turned. And so there's stuff touching things that it shouldn't. Like I used to be able to touch my hip bone to my rib cage.
Yeah.
Which is gross, by the way. I don't like it. I did it, but I don't like it.
We used to click them. Like you would get them to touch.
It
and
was
like
nasty.
whatever. I forgot about that.
Right? I was much skinnier at the time.
We both were. We were twigs at one point.
Oh, yeah. Oh, my God. I was looking at pictures of myself from years ago. Holy crap. I am pleased with the weight that I have gained.
Right? Like, improvement.
Yeah. Wow. Because I was always like, my bones hurt.
My bones.
My bones. Because they just did. It was not nice.
All right. So for the rest of this, let's just talk.
Yeah?
What do you got going on in your life?
Oh, my God.
What traumas are you dealing with?
What traumas am I dealing with? Feeling misunderstood in group is a really big one right now.
Oh, man. That was so frustrating. So frustrating.
Yeah. And it's not even like it's not like something I can be proud of and be like, oh, I'm ahead of the curve, because that feels gross to me. Like, I don't like how that feels. It feels like I don't know, like superiority complex or something.
Right.
But I don't know. I'm feeling, I don't feel like I'm being met at all. Like, and I'm trying to meet them where they are, but also.
That's part of the downside to the group. Especially the style you do. Mm-hmm. Like, I'm surprised they don't do more solo therapy with it. You know what I mean?
Right. Well, and I could schedule more solo therapy, but
I think it should come with it.
Right.
You still need the solo attention, and then you could even, work on new skills or different techniques and stuff. Because,
like, I'm doing well overall.
Yeah.
But I'm also just questioning everything because, I've been told that I'm avoidant, and so I'm, like, trying to find all of those things and, like, be conscious of them. because I like to. I like to like know what's going on with me.
Well, someone's introduced a new puzzle piece, possibly, and you're
right.
like, okay, I guess. Let's find out.
Like, let's go find it. But then also learning from neurology that no, there's a reason I do that.
Yeah.
And it's not because I'm being avoidant. I'm like, this is how I have to live my life. But that's also part of the like feeling misunderstood piece, is that they are looking at two things. They are looking at pain and PTSD.
Right.
And linking them together. Whereas where my pain and PTSD meet is in medical trauma and in parental neglect. That's
made a mess.
Right. The camera would have gone backwards. It would have been great.
Would have been fun to edit.
Yeah. But medical trauma and parental neglect. That's where my where they meet.
I think the problem is you're just in the wrong group.
Yeah.
Like,
I need leveled groups. Didn't I say that last week? I think.
Yeah.
I don't know if it was on camera or not.
Because they're running it with a fucking Venn diagram,
groups.
right? Where in a normal reality, every patient is in the crossover right here in the middle. Mm-hmm. So there's like PTSD and then there's pain, right? But you have this fucking problem where it's like this. I have PTSD and I have pain,
right?
But there's no overlap,
right? They don't. Yeah, they're not friendly with each other. Because when I have pain, I call it out as pain.
Yeah.
And when I'm going through emotional upheaval, it's not like the pain gets worse. The pain usually fades into the background, and then I don't notice it until the evening when I'm crashing.
Yeah.
So.
Okay, so for that to work, that specific thing, this is what we've talked about in my therapy before. I know about this.
Okay.
It's more when you're idle and you're dealing with pain. Mm-hmm. And then you have stressors on top of it, right? Mm-hmm. So people who are focused on their newfound pain and then have things on top, whereas we are always in pain.
Right.
So it's, and you also notice it more too, right? Mm-hmm. Because you're stressed out. It's a thing that's on your list of things. And
right.
So you're on a checklist of like, well, now I've got to go deal with this problem, and I'm in pain. And so it's for you, it's different. Because it's just constant pain. Right. And then, well, let me turn out everything so I can go settle this. Right. You can focus.
Yeah. Well, and because I've hit a point where I measure my energy so much differently, like I was saying in the first half, like with my husband, I could have been super worried. I could have left the appointment, but I knew, A, he was being picked up and taken home. Yeah. And that was good. And she was going to grab the workman's comp paperwork, so we had it. And I was going to be 20 minutes behind them. Right. And that was fine, because then I was going to have more information in 20 minutes. Right. So instead of like panicking over it until I knew what was happening, I was like, okay, let's leave off everything until I know what's happening. Right. Because it is a waste of energy to put myself into a panic and then waste all this energy and then find out that it wasn't as bad as I thought it was going to be. Right. Right. So it's that same thing of like, all of the possibilities and you're like, okay, I know what it could be, but until I have more information, I don't know what it is.
Right. We don't deal in what ifs.
Right. I'm like, it is or it isn't. Mm-hmm. Right. And so it's frustrating because you're right. Like they all exist. It all exists inside of itself. Right. Mm-hmm. But we have like pain over here. We have the PTSD, which is actually complex PTSD. And so we have a harder time identifying what is what. Mm-hmm. And then you have the dysautonomia. And then you have the MCAS. And then you have like, it goes on and on and on. And then you have like dislocations, right? Yeah. And then you have family problems. And then you have like
yeah, no.
It's all part of itself, but it's also different. Like they're different things and they don't always interact with one another. Yeah. And so I get frustrated because they're trying so hard to link the pain and the PTSD when like maybe they do meet, but it's like passing ships, right?
Yeah, the closest you get is medical trauma.
Right. And that's exactly what it is. So for me, there are no stories to be told about the pain. The pain just is.
Mm-hmm.
I don't tell stories about having a shadow. Like, that's not how that works. And that's how I think about it. Like, the pain will always be with me, no matter what I'm doing, and no matter what pain medication I am on.
Yeah.
Something is going to hurt.
Yeah.
And that's just how life is. It's just how it is, right? So, I mean, for me, a lot of it is undoing the PTSD and the beliefs that I had about myself or about the world based in that. That is different from the pain. It's not the same.
Right.
And they don't always amplify each other. Usually it's the fatigue that amplifies the pain.
Yes.
That is where I get caught up, is because if I don't have the emotional energy to sort out and deal with the pain, I get frustrated, and then I start feeling sorry for myself, and then I hit this like sinkhole of depression.
Same. Yeah.
Right. That is how that leads to the sad.
Mm-hmm.
But it doesn't lead to the PTSD.
No.
It just leads to I'm tired and I'm in pain and I'm tired of being in pain.
Right.
That's the story. And so it just feels so separate for me, whereas other people it's the same thing for them.
Right.
The pain is linked to the event that caused the PTSD.
Yeah, that's what I mean. Like, you're just in the wrong class. You need to be in like a strictly pain one, or one that deals strictly with like PTSD.
Right.
Because then you could follow along just fine.
Right.
And
I need CPTSD because I can't. There's not an event that I can identify.
Yeah.
I mean, I could talk about being a runaway forever, but I've dealt with a lot of that already.
Mm-hmm.
Just either on my own or with my personal therapist.
Mm-hmm.
So I don't know. It's frustrating. It's frustrating and it's hard, and I get that, like, I have to do this. This is something that I need to do so that I can continue being seen by pain management.
Yeah. Because
they are on the verge of like kicking me back because I'm too good at stuff. I don't know.
Go figure.
Right? But it's hard because also my primary care doesn't want to manage the pain meds.
Right.
Because I think there's a lot of stuff going on
behind the scenes.
Yes,
yeah,
exactly.
Oh yeah.
So I know that there's a lot of like procedure in a lot of how my care is handled. But yeah, I don't know. I don't know. And having you go to group with me has been really helpful because I don't feel crazy when I leave. Because sometimes I'm like, that was horrible. Was that horrible? Am I just the worst, or was that horrible?
That was legit not fun.
No, it was awful.
I never had any experiences like that with ours.
No.
I wasn't full of single white women, so.
Right. It was weird. It was really weird. Because they called out, like, at one point, they were like, how do you deal with ableism and, like, societal structures that are against us? And I was like, ooh, this will be really good. And then it turned into, I'm a bad friend because I can't meet society's expectations.
Right.
And I was like, that has nothing to do with anything.
It wasn't what you wanted.
What?
You wanted the in-depth.
Yeah,
I know.
I hate this like scratching the surface thing, which is why we have these conversations, because I need to pick at it.
Mm-hmm.
Because we know, like we've talked about, like I like to take things and turn them over and examine them, and but I'm not getting. There's not enough stimulation, and there's a lot of like misunderstanding that happens, because the week before, it was the stuck point of like, oh, rest is bad, and I was like, but I don't think rest is bad. I love rest.
Right.
I could sleep forever.
And we know there's a physical reason that you do what you do.
Right.
Yeah.
So now I don't feel quite so crazy, because it was like, really? That's a stuck point, really?
We just need to get them to start a different group. Like, you don't have to connect the two.
Mm-hmm.
There is a way to deal with like your non-PTSD, but you still have, if you don't have PTSD, you still have the same struggles, the same thought patterns, the same.
Well, and the whole idea is that like PTSD and pain are linked. And I'm like, that's great.
When they are linked.
But like, I have EDS, which is multiple physical causes for pain.
Yeah.
And dealing with my PTSD is not going to change the fact that when I dislocate, it hurts.
Right.
Or the fact that I have a movement disorder that causes ungodly amounts of pain. Because I think at this point, it's like 75% of my pain is the movement disorder.
Yeah. I'd say
because of the spasms. The spasms are awful. And the spasms cause dislocations.
Mm-hmm.
And the spasms cause loss of sleep and inability to eat because my abdominal muscles are clenched. And like, there are physical things happening, but I think because she asked me about it being tics at one point, and I was like, no, because it's not something that I'm like, oh, I need to do a movement. Mm-hmm. This is happening whether you like it or not.
Right.
And it's just happening. But I think they're thinking along the line of conversion.
Really hope not.
I hope not too, because even when we did the EMG, is that what it is? The EMG, the muscle one, the muscle study?
Yes.
The guy who was doing it was like, I can't diagnose, but I can tell right now that there's something wrong with the electrical in your body. Mm-hmm. Because when he was going through it and you can hear your own muscles, there isn't like an idle. They don't idle. They do this like triplicate flickering.
Right.
And when you tell it to release, it takes a minute. Like, it's on a lag. So relax is on a lag.
Yeah.
And everything in my muscles does that like triplicate flickering. So there is something electrically wrong.
Yes.
And we know there is within the muscles. But I'm also learning that like that could be, I don't even know. Like dysautonomic could be linked to that.
Yeah.
Who knows? But it's not conversion, guys. It's just not.
No.
Because I'm not running from emotion either. Mm. Like, if I need to feel a thing, I feel a thing.
That's what I was saying last week. It just doesn't make sense. You're not avoidant.
Yeah. It's frustrating. I don't know. Are you going to have group with your new clinic?
Probably not.
No?
I'll just have Libby.
Okay.
Which is plenty for me.
Yeah, Libby's good. That's awesome.
Libby's the best. I like my team.
Yeah.
It's funny. They're all from New Health.
Well, I'm glad, because it's not like a huge transition.
No. Yeah. Like that's, and they're all still working together and recommending each other. So.
Uh-huh. Can you imagine if you had to start again from scratch?
Oh, yeah. Yeah. Ugh. Especially with pain management, like directly. I've had like 4 docs now with New Health, and then now we're at Med Now.
They seem to have a really high turnover rate within that field.
I was the board, I'm pretty sure.
Okay.
Because it had to do with those 3 guys that were from overseas.
Yeah, in Turkey.
Right. Mm-hmm. And then poor Diane being the 4th partner, but being ignored.
Yeah.
So I'm pretty sure it had to do with that and money, for sure.
It's always money.
Or there were a lot of like procedural stuff they wanted them to do that made no sense and wasted money.
Mm-hmm. Yeah, that's a big one.
Yeah.
I don't know. It's just frustrating because you have, and it's frustrating all the way around, because now we're in this like opioid crisis, right? Mm-hmm. And you're like, okay, but here's the thing. Y'all created that. So don't punish the people who are in pain. Like, we need resources for people who are addicted. Mm-hmm. And we need to not punish the people who are in pain. The end.
Yeah, no.
Right? Like,
it's just so frustrating when you know that you're a responsible person. Mm-hmm. Like, you're following everything. You're not doing anything wrong. And then you can't win.
Yeah.
There's no winning to anybody.
We're following the rules. We're doing all the recommended stuff. And that's part of the thing about like documentation. In order to avoid some of those labels, we have to go through an unreasonable amount of humoring.
Yeah.
Like, we have to do an x-ray before we can do a blah, blah, blah. Yeah. And we have to do this before we can do blah, blah, blah. Finally, they've stopped being like, you have to do PT before we can do anything. Because they know I'm working with a trainer. I've had 3 other joints worked on.
Yeah.
Like, there's a legitimate problem here. Their concern right now is that they're like, the capsule might be shredded and we might not be able to tighten it at all. And I'm like, that's fine. Fix the labrum.
Yeah, see if we can do something.
Like, if you can fix the labrum, I'll take it. You don't have to worry about the capsule. That's fine. I'm going to stretch it out anyway. Doesn't matter. Just fix the hurty part and maybe sand all that shit down.
Little cleanup, please.
Yeah.
Just touch it up.
Something. Right?
Yeah.
But it's frustrating because we've just been dumped into this group of people who are afraid of their pain. Yeah. And are afraid of memories. Well, and are afraid of like confronting themselves.
What's not fair to them either is that like that they've putting you in the group doesn't help them, like with examples. Like sure, there are things that you can force your way into using the like formula that they've made. Right. But they like to use you as an example, but it's not the same thing. You don't have this traumatic event. Right. And then like pain that's associated with it. So like as far as a group conversation goes, there's a disconnect. Yeah. Yeah. So like it sucks for everybody. Right. You're not getting what you need out of it. And they're like having to listen to you go through shit and be like, what? Because you're like, you've already processed things and you can say things like, well, I don't associate the pain with this, and they're like, right. They're not there yet. They're still back here like piecing it together. So
right. And then I feel like an asshole.
Right. It's not fair to you.
No, I don't like it. It's frustrating. I don't know. So maybe I'll make an appointment with Jackie and talk through it. I'm going to give it another week to see if we can get some momentum.
It's not like you're going to go in and be like, Jackie, group sucks. Right. I can't recommend it enough that you end that.
I just need to be out of it. It's just not fun.
Jackie.
I'm not having a good time.
You've made a thing, and you're gonna have to pay for your crimes.
You made me do this.
Oh my god.
It's just not fun. And like I get it. Therapy doesn't need to be fun, but I'm also not getting anything out of it.
That's what you mean by fun. It's not engaging.
Yeah. Because that's the thing, like I am not somebody who is going to turn away from introspection. Like I'm going to point out a flaw and I'm going to like go find it and turn it over in my head and work with it and adapt, right? Like I want to do that. I'm happy to do that. I'm not being avoidant, but I'm bored. Not having fun. I'm bored. And I don't know. CPTSD is different. Yeah. Because there's not events that I can really point to. And also, I have horrendous memory. Like, awful memory. Things pop up at random, but only in context.
Right.
And so if I'm sitting there and I'm like, they're like, do a stuck point. And I'm like, I don't remember what any of my stuck points are. And also the ones I had before, I have now adapted and worked through.
Right. Use a past stuck point.
Which is boring. Yeah. And I can't think of them after I've been like, yeah, that can go bye-bye. Like, great, I'm the problem, but I don't believe that anymore.
Right.
I do not believe that anymore. Like, I firmly
And you can identify when you're having that thought.
Right.
And be like, that's dumb.
Right. Well, and when I do go through something, I call it out and I message you and I'm like, haha, stuck point, here it is. My brain's an idiot.
Yep.
And we've done all the work and it's so frustrating. Like, it's great to like have it reinforced, I guess, in a way, because like the unhelpful thinking styles, I've been working with those for probably 1.5 years, 2 years.
Yeah. We first did our first video on it like last summer.
Yeah. So we've been here.
We were on the couch.
Worked through the things. Yes.
Couch era.
The time of the couch. It was a good time.
You're like, I miss the couch.
I like the chairs, though. I like having the table.
She likes the table.
I can make noises. But I don't know. It's frustrating.
Yeah. One more week.
Yeah. I'm going to give it a week and see what happens. But if nothing else, because she'll bring up things like before we got to the point where I was like, no, my family relationships were crap growing up. And these are the beliefs I have about that. But again, like, I don't internalize that
Right.
necessarily. Like, I've moved past internalizing it because it wasn't my fault. And I believe that it wasn't my fault. And I don't have to believe that it was, or, right? Like,
Yeah.
I don't know. It's frustrating. And it makes me feel like an ass, and it makes me feel like an imposter. And that's where I'm getting all of this, like, yucky feeling.
Yeah, no, I don't blame you.
Where I'm just like, am I not? I don't know.
Am I the problem? I don't know.
That's exactly it. Like, am I?
It's triggering your stuck point. No.
Right?
Cyclic
like,
redundancy.
This is so frustrating. I just wish it was faster. Move faster. Let's go.
Yeah, maybe next week will be good.
Let's go.
We don't know.
And stop making me do papers, because that's like, show your work. And you're like, I don't know how I got there. I just got there.
Yeah.
I arrived at the correct answer.
I'm just waiting for the week where they're like, this page is blank. Now work through your trauma. Like, just, you're supposed to go through like that full sheet of, like,
I have not been keeping
I
track
have
of the
this.
subpoints.
These are my questions.
No. Nope.
And then you're going to fail, and they're going to be like, no pain management for you. You failed pain. You flunked
You get
out.
an F in pain management.
Your PTSD is too severe.
When did you realize that, like, a lot of the beliefs you had were based in PTSD? Or what was that realization like for you?
Oh, I want to think about when. Probably when I acknowledged that I even had it. Because it's like the day that I was diagnosed with it, I would sat down and worked it out and started filtering everything through it. You know what I mean? Like, starting from this point, it would have been this from this source and from this, you know, and just kind of reframing everything. So
see, we both do it. Okay,
yeah,
that makes me feel better.
Oh, totally.
Like, we are almost obsessive about introspection because we're like, we didn't want to be the problem.
Right.
And so we had to examine everything to not be the problem. So we're really good at it.
Yeah. So yeah, it would have been probably like when I was 30, 31 maybe. And I mean, I had the same thing with being bipolar. Like, I fought it when I was younger, but when I was diagnosed as an adult, I was just like, oh, okay, add that to the list, and let's find out what that's like and learn about it.
Right. Well, again, with like being knowledgeable on your own conditions, like, that helps us to reframe things.
Yeah.
It is important to understand where our, like, flaws in thinking are coming from, or where the things that trip us up are coming from, and our difficulties. Like, if you can recognize it, it's less threatening.
Yeah.
In the end. Yeah, I don't know. I just want something challenging. I want something that is like,
I'll come
rigorous.
up with a curriculum that's challenging.
Yes.
It'll be just the worst. It's going to be math questions and history.
No, I don't want that.
But it's all about you. It has to be your history and your math. Karina's specific math.
Oh, no. It's like when people ask about, like, baby pictures and you're like, I don't have any of those.
Yeah, I don't.
I don't have any of those.
I have some. Mom has some.
I'm sure my mom has some. I don't know.
Maybe.
I don't know.
I don't know either.
Yeah. I don't know.
You want to call it?
I think so. It is time, because I have to take my medicine.
She does. She really does.
I'm a monster. I'm just going to repeat that. That's my stuck point.
I'm a monster.
I'm a monster. And they're going to be like, explain that. I have no explanation.
I just am.
I'm a monster.
But why do you think that? Oh, I don't.
Well, you see, it was like a veil was lifted. And a monster was there. Oh, no.
That hurts so bad. Don't do half laughs. Laugh out loud. Ha ha.
Ha ha. Ha ha.
Yeah, that's how I have to laugh from now on.
Ha ha.
Permanently.
Ha.
Not until it heals, just forever.
Forever.
Ha ha. Ha ha.
Great. Wonderful. Yeah. All right, my friends. Thanks for coming along. I hope this was something you can relate to, or helped you to better relate to someone in your life. Yeah, not a lot of resolution, but definitely make sure you are able to access your own documentation and you know what it says and you know what it means.
And don't be afraid to question some of them if you need to.
Yes, because I just got anxiety removed from my file, finally, like 4 years later.
Mm-hmm. And like I said earlier, we got rid of over-medicated off mine.
Mm-hmm. Yep. Yeah, there's a bunch of them that, like, be careful and know what the, like, jargon means. Like, go check out some TikTok, because you'll better understand, I think, what some of that jargon means. So thanks for hanging out. We appreciate it. We love you guys. Until next time, I guess, like, share, subscribe. Here's my shill. Oof,
here it
it's
comes.
my turn. Join us in Discord. We would love to hear from you. We also go live on Discord on Fridays, usually, most of the time, barring medical emergencies.
Yeah.
We came back and got on the live, though.
I was proud of that.
Which was awesome.
I was like, no, I'm going.
I really thought you'd be like, let's go home and, like, nap. No,
let's
He
go
was like,
talk.
I'm ready to live, with his mouth full of gauze.
Yeah, it was great.
It was awesome. All right. Until next time, be kind to you, be kind to others, and we will see you in the next one. Bye.